Duchenne and Becker muscular dystrophy are X-linked recessive disorders that are caused due to mutation in the gene called dystrophin. And the function of dystrophin is to provide mechanical support to the muscle fibers of the skeletal muscles and the heart. So defect in the dystrophin gene makes the proteases capable of destroying the glycoprotein complexes that are on the cell surface, and thus it would lead to the muscle fiber degeneration. And thus the prominent feature of this disorder is weakness. So there are two forms, Duchenne muscular dystrophy and Becker. So Duchenne is a more severe form that is most commonly caused by deletions that are usually from frame shift mutations. And the clinical features of Duchenne muscular dystrophy include muscular weakness that initially starts in the lower extremities and then it moves up to the upper extremities. And they usually start to show symptoms by 2 to 3 years of age. Now, since these patients are initially affected in the lower extremities, therefore they would have difficulty running or climbing the stairs. So difficulty running, jumping, or climbing stairs. In addition, again, the lower part is more affected than the upper part. So when they want to stand up from a sitting position, they would use hands to stand up. And this is referred to as Gower's sign. Another feature, as I mentioned, dystrophin affects both skeletal and cardiac muscles. So therefore, another feature in these patients is dilated cardiomyopathy. And then finally, these patients usually die of respiratory failure. One other important sign that comes very handy for diagnosing Duchenne muscular dystrophy on the exam is pseudo hypertrophy of the calf muscles. So calf muscles will initially undergo true hypertrophy because there's too much degeneration of the muscles. They would keep building up and build more muscles. But then eventually these muscles would be replaced by fat, and therefore it's referred to as pseudo hypertrophy of the calf muscles. And then the other condition that I haven't spoken yet about is Becker muscular dystrophy, which is a milder form of Duchenne muscular dystrophy. All right, and one last point I would like to talk about is the diagnosis of Becker and Duchenne muscular dystrophy. And there are two ways that you can do it. One is to obtain biopsy of the muscles. And then the second test is to measure the levels of creatine phosphokinase. So creatine phosphokinase is the enzyme that is abundant in the skeletal muscles and the cardiac muscles. So due to the degeneration of these muscles, the levels of creatine phosphokinase would be elevated in these patients. And that concludes our discussion.